Coming up on HKB Uncut.
It made me think about, oh my God, this is the reason why we do what we do.
It's weird because I felt like he did all the work, but for him, I was a huge part of him doing that.
But that's our why, right? That's what gets us up every day to do what we do.
There are a certain segment of patients though who want to, and obviously we need to approach them in the right way and make sure we're getting the result that they want. Sometimes it may not be the aesthetic that he and I want, and that's okay.
Segueing into cosmetic surgery for men, I just want to know, what are you guys seeing in your practice when it comes to either older men, younger men, if there's facelifts, rhinoplasties, what are you guys kind of looking for nowadays?
I think it's becoming more the norm for male patients to ultimately have aesthetic services. And,
Totally.
I think we're both been patients. Mm-hmm. We both wanted things.
I had no hair back in the day.
I wish that was the case. I'd have G's hair tomorrow. But there's no taboo anymore about having it. Men are talking about it, and so it's very common. I mean, I know we both do a lot of liposuction. We do male tummy tucks, facelifts, eyelid surgery. Anything you ultimately can think of, we can do both on men and women.
Yeah, and there's certain things that have just ultra high satisfaction rating that men were so self-conscious about, and when you alleviate and get rid of, it's a huge change from gynecomastia procedure where people have some excess, breast tissue. I mean, that is game changing. There are other things that are more esoteric things that we do that are pretty interesting, where maybe a guy has a leg deformity, has a absence of a calf muscle, or has one side where it's small, and the other we can augment one side and fix that. And you would think that's not that important, but it is really important to a lot of people. And there's stuff where people were born with, something called Poland syndrome, where they don't have a pec on one side, or there's some big asymmetry. And we can do, interesting things that are non-traditional, where we can do a pec implant in there, and it gives them a total rebalancing of their physique. And those things they're very powerful. So a guy, just like a female, they're consumers of our services. And I think that it's very much so normalized, and it's normalized for one reason, because we can get results that don't look like operated results. I mean, that's the thing. At the end of the day, we don't want any of our stuff to look like it's operated upon. There are a certain segment of patients, though, who want to, and obviously we need to approach them in the right way and make sure we're getting the result that they want. Sometimes it may not be the aesthetic that he and I want, and that's okay.
Yeah, there are a few occasions where, all patients across the board that it really impacted me, but one in particular on a male patient, I remember this was probably 2 to 3 years into my practice, where this guy came in. G kind of alluded to gynecomastia. We do a lot of that. It's actually removing gland from a guy's chest. He was a college student. He came in, kind of, looked down, didn't really want to, talk about this issue. And he's like, hey, this has been bothering me forever. I've never taken my shirt off and pee. I've never taken my shirt off at the beach. I'm really conscientious about taken showers, in public or doing anything. And it's this is something that's affected me my entire life, is having male breast tissue. Routine case, did the surgery, patient did great, looked great. Followed up, didn't really hear from him, after 3 to 6 months, but a year goes by. I get a card in the mail, and the actual card, he had a picture of himself with his girlfriend at the beach, shirt off. And he's like, Doc, I can't thank you enough. You ultimately changed my life. Look at me now. And that really kind of, it made me think about, oh my God, this is the reason why we do what we do. And it's still, to this day, I remember it many moons ago, but it's still, every time I think of a gynecomastia patient, I think about that guy, that we made that difference for.
How long ago was that? That was awesome.
2011, so 15 years ago. But it's pretty remarkable,
old,
though,
man.
what we do.
It is. I'm not gonna lie, I've had so many, and I can tell you all kinds of just crazy mega transformations. But the one that sticks out in my head is there any, because it seems simple, but it's a young guy that I took care of. He, professional father, husband, Really just annoyed at, kind of circumferential trunk, kind of excess fat. He just wanted that to be lessened and maybe a little bit in the chest, kind of the hip roll area. And so we did kind of our tried and true, which we've been doing for, a long time now, where we did multimodal energy-based liposuction. And he got a great result. And, after the surgery, I mean, he's just like, when I saw him in follow-up, I saw him normal follow-up is good. And then when I saw him in, long-term follow-up, he's like, Dr. Bharti, you're a magician. And like, it's fun when people say that kind of stuff. It makes your head bigger. And I got a huge head already, like a big ass head. You see that thing? Anyway, but he the thing that was so genuine, you can tell when someone's being, he's like, you changed my life. Like, you changed my life. And I'm so indebted to this. And like, I mean, just like so much. And it's like, it makes you feel so good. But you're like, man, I'm just doing what I do. I just did my job and what you wanted, but so incredibly grateful for it. And so he disappears for a while. And then he comes back and sees me, and like, this guy comes in and he is jacked. Like, he is shredded out, super lean. And he's like, man, I'm back. I want to see you because I want you to do some more stuff for me. And like, you helped me get to this point. You helped me, become this guy. And like, you, in some ways, you saved my life. And I was just like, how did I do that? I wasn't understanding, but I guess it was like kind of a part of his process. Anyway, this guy is so shredded. He's like this ultra, athlete now, and he lifts weights all the time, and he's just like gotten so lean that he developed excess skin. He's like, nah, I need to get rid of the skin for me. So I did a, skin only abdominoplasty on him, and he's looking amazing. And it's just like, it's weird because like, I felt like he did all the work, but for him, I was a huge part of him doing that. And so, it just reinforces the concept that we're part of this interplay. But it's nice to have that feeling, when someone makes you feel that way. It makes you like so proud of what you do. But more than anything, I'm proud of him.
But that's our why, right? That's what gets us up every day to do what we do, is to be able to create these changes in individuals, and hopefully for the better.
Mm-hmm. Totally. All right. Well, that was a fun discussion. I don't know how I keep having all these discussions with Bill, and somehow they're all fun, but after a while you're like, man, are we really gonna have another talk together? But no, I'm kidding. They're great every time. So we look forward to seeing you guys next time. Any comments or questions, please hit us up, even if they're mean ones. Just kidding.
Subscribe. Thanks for listening.